these 4 pictures represent the different and anatomic planes we see on CBCT scan. So the true planes are axial, sagittal, and coronal, and the 4th one, which is more of a cross-sectional images where we get series of cross-sectional images, is called as transaxial view, or the cross-sections, custom cross-sections. So, just to go over the basic orientation of the planes, here this picture is depicting an axial plane. So axial plane is, is also called as transverse plane. It's, it slices anatomy from top to the bottom, from your head to toe. So this what compromises an axial plane. The second one here is called coronal plane. It slices through the anatomy from front to the back. The third one, as you can see here, is called sagittal plane, and sagittal plane is a slice through the anatomy from side to side, from left to right or right to left. And like I said, the other one is called transaxial, or the cross-sectionals. Cross-sectional images of an area can be developed with 0.5 to 5 millimeter spacing between the images. So you can customize your cross-section on the axial plane in whichever area you want to. So this picture here shows a diagrammatic representation of the various field of views, starting from the large, medium, and the small field of view, and the area of anatomy it captures. The last one represents the superimposition of the scans, where you can stitch multiple small field of view scans together to create a larger field of view to view the larger area of the anatomy. The importance of reorientation is to just make sure that you align your anatomy on the basis of the orthogonal planes here. So how I like to do is, I just want to make sure that the symmetry is maintained bilaterally on the right and the left side. This is the medial line, anatomical midline. And I like to keep my hardwood parallel to the floor, or parallel to the orthogonal plane here. And again, reorienting the coronal view like this. So I know that my scan is symmetric and I can readjust the patient positioning. So this is the good way to start reviewing your CBCT scan. Frontal sinuses, orbits here bilaterally. This is the ethmoidal sinus area. These are 2 sphenoid sinuses, and the sphenoid sinuses are often divided by a bony septa, and usually one of the sphenoid sinuses is bigger than the other. In this case, the right one is bigger than the left one. And this is the sella turcica. These are the mandibular condyles here bilaterally, which are positioned in middle of the mandibular fossa. And the maxillary arch, we see the hard palate here, right maxillary sinus, left maxillary sinus, coronoid process of the mandible. And this is the C2 odontoid process. This is the oropharyngeal airway. And this is the hyoid bone. You can create a reconstructed panoramic image from your CBCT scan. And this is the panoramic image. And then what I would like to do is, what I usually do is, I kind of scroll, and this is the cross-section area of this slice, or the cursor your cursor is at this point. So this is tooth number 2 and 31 in this area. So you'll see this is your tooth number 2, and this is in occlusion is tooth number 31. So as you can scroll further, you can see you can review all your dentition in the dentoalveolar area to rule out any apical pathology, or just to make sure the health of individual dentition looks fine. And again, this is nasopalatine duct canal. And then there is another function where you can kind of review your TMJ area. So this is the cross-section of the TMJs, right and the left. As you can see, this is the right side, this is the left side. This is the medial surface of the condyle, and this is the lateral surface of the condyle.